Assalamu alaikum and hi everyone. Welcome to this MOOC 910 course. This presentation is the introduction and general concept for the specimen collection and handling of common samples for microbiological laboratory investigations. We hope that by joining this course, you will have a better understanding about this topic. The objectives for this topic are: first, is to learn on the types of containers and preservatives used for specimen collection. Second, is to have an overview of general concept of specimen collection and handling in microbiology laboratory. Third, is to identify the appropriate specimen collection, transport, and storage of specimens. The content for the subtopics are: 1. General concept. 2. Collection techniques. 3. Specimen transport. 4. Specimen preservation techniques. Subtopic 1 and 2 will be covered in this presentation. Subtopic 3 and 4 will be covered in next presentation. First section is the general concept. We have to understand the importance concept of good specimen collection handling. This is consider a critical considerations because in order to get a valid results, it depends on the quality of specimen upon arrival to the laboratory. Most importantly, risk of contaminations should be reduced as the normal flora of the anatomical site from the specimen's collection area might be present in the sample. The normal flora might not be the pathogens causing the disease. For example, the initial steps like careful skin preparations before procedures like blood cultures can decrease contamination of specimens. Next is collection techniques. These are a few considerations of collection techniques that need to be practiced in ensuring that a quality specimen is obtained. First, specimens should be collected during acute phase of infection, or within 2 to 3 days for viral infections. Next, specimens should also be obtained before administration of antibiotics. Specimen-like tissue or needles aspirates are preferred over swabs. A manual handbook or instructions from the laboratory experts should be provided to the clinician as a guide for optimal specimen collection technique and transportation. Instructions should be in written. An example of the handbooks is the Clinical Laboratory Handbook prepared by the Department of Clinical Diagnostic Laboratory Hospital University Technology Mera. In the written guidelines and handbook, the informations that need to be included are: 1. Safety consideration for both clinician and laboratory personnel in obtaining the samples as we are dealing with infectious samples. Next is the selection of appropriate anatomic site for collection. Then, clear instructions for specimen collection should be included as well as the type of swab and transport medium. Next, the instruction for transportation, including the time and temperature of the specimens should there is any delay for the specimen to reach the laboratory. Labeling the specimen is another important factor. Information such as patient demographic must be accurate to avoid mistake. Lastly, if there is any special instructions like patient preparation, it has to be included in the guidebook as well. Before the presentation ends, hope you can try to answer few questions related to this topic. Thank you.